All right, good afternoon, everyone, and welcome to FWMD Live. Today, we are hoping to address many of the questions you all may have regarding COVID-19 and vaccines. We know that every person locally and worldwide has been impacted by the current pandemic. So today, we're going to talk about what we have learned. Why has the development of vaccines been faster than usual? Why do underserved populations have a higher mortality rate? And also, what are some of the issues surrounding the vaccine's availability and distribution to different groups of people over the next several months? Now, I'm your host, Prescott Stokes III, the Integrated Content and Marketing Manager here at the TCU and UNTHSC School of Medicine. And today, we are most fortunate to have Dr. John Silva joining us for our conversation.
Hello.
All right, thank you, Dr. Silva. So I just want to give everyone some background on Dr. Silva. Dr. Silva is a nationally recognized leader in biodefense, emergency response systems, and the development of large-scale health information systems. He has also been a chair of surgery and the director in the Office of Informatics at the National Cancer Institute, and he is presently a research professor at the University of Texas at Arlington, with whom our medical school is forging a robust educational and research relationship with. So we are very, very happy to have Dr. Silva joining us for this discussion today. And also joining me as a special co-host today for our discussion is Dr. Stuart Flynn. Dean Flynn is the founding dean of the TCU and UNTHSC School of Medicine, and he has spent his career as a surgical and molecular pathologist. Welcome, Dean Flynn.
Thank you, Prescott. Welcome, everybody. And I want to just take a moment, because I won't get a chance, to really sincerely thank Dr. Silva. We're in for a treat, and I really appreciate your willingness to do this. So thank you.
My pleasure.
All right. So Dean Flynn and I will be asking questions to Dr. Silva today about COVID-19 and vaccines. Now, if you want to be a part of this conversation, it's really simple. All you need to do is jump into the comments on Facebook, leave your question, and then we will definitely get you some answers from Dr. Silva. But before we get to the questions from our audience, Dr. Silva, let's begin about the great deal that we are hearing about safe practices of avoiding getting infected with COVID-19. But still, we are now in the so-called third wave of infections, and we see cases rising across the country. We see cases rising in Dallas County and Tarrant County. Can you just give us an idea of what you believe is driving the increase in these infections? And also, what can we still do to avoid the numbers going up and keep ourselves safe and healthy and not come down with COVID-19?
Prescott, that's a very timely and great question. Could you bring up chart 1 point, please?
Sure.
At the start of this year, if we remember back to February and March, there was an incredible surge of cases in New York City and in New Jersey. Prior to this year, the entire United States was what's called a naive population. That is, we'd never seen COVID-19 before. And as a result, the entire nation had no immunity to protect us. And so it ran over New Jersey and New York. Now, in terms of what you can do without a vaccine, take a look at their examples. Both governors basically closed the states down. They issued stay-at-home orders and started to work with the CDC to promote recommendations to wear masks, do social distancing, and don't go to bars and things like that. As a result, the curve flattened out. But as Dr. Fauci mentioned, we never got back down to a level below 20,000 cases a day. That's where he had expected us, were we able to really put this epidemic on its back, like a lot of other countries in the world has done. Well, we did not do that. If you notice, there's a second peak that occurred right after Memorial Day and around the 4th of July, where people were not socially distancing. There was some questions about whether people should or could wear masks. The restaurants and bars and other places that had been shuttered because of the orders now started to open up. And unfortunately, the reason that the virus spreads as a viral is that people that are infected, and many of whom don't know that they actually have the disease, can infect other people that are naive or unprotected. And as a result, now the rest of most of the country is exhibiting a huge wave 3, and ICUs, particularly in the northern tier states, are being overwhelmed. And we'll talk more about what can we do now to get off of this peak. But the CDC recommendations of staying at home, getting masks, doing social distancing, and potentially in some states which are already beginning the stay-at-home orders are going to have to be instituted.
All right, that is great information. And I just want to say that slide that we had up, that came from the CDC's website.
Correct.
COVID-19.
This morning. So it's
as early as this morning. So we're giving information that's very timely during this conversation. Dr. Silva, I also want to talk about the intense interest that we're seeing in vaccines. So there's so many stories in the media, especially over the Thanksgiving holiday, about vaccines and preventing people from getting sick from COVID. And so we know Pfizer and BioNTech, and also Moderna are producing vaccines. Can you just kind of give us some general principles as to how vaccines work and why there's so much discussion about the value of the majority of our country actually getting these vaccines once they're available?
Well, I think those of us who have children are well experienced with vaccines and why they're really useful to prevent childhood diseases, and some of which are potentially very dangerous to young people. Basically, vaccines work by injecting, or called vaccinating if you're in the health industry, one or more viral proteins that are foreign to us. But if we can make antibodies, if you could bring up chart 2 would be useful.
Sure.
The antibodies, those kind of red tipped areas, are specifically designed by our immune system to attack and attach to the viral particles that the virus needs to proliferate and to infect our cells. So the whole goal here is getting vaccinated means that your body is prepared to fight the virus before you can give it to your family, friends, and the community writ large. Unfortunately for the COVID-19 virus, it is significantly more infective and lethal than any of the flu viruses that we've had for a very long time, except perhaps the Spanish flu in the late 1915, 1918 range. The whole idea is that if you are vaccinated and prepared to fight the virus, then you can't, you won't be able to transmit the virus to other people. And that's the kind of the ultimate goal of getting a vaccine to the population quickly. It's not just a matter of flattening the curve, which these other activities can do, social distancing, et cetera. But you really want to be able to get to the point where, as Dr. Fauci mentioned before, get down to less than 5,000 cases a day, and that's when we can actually kick this virus out and get back to doing what we would like to do, the normal.
Right, and that's some really good information. And Dean Flynn, I know you wanted to talk to Dr. Silva about the journey, and that was just a really good infographic that we got from the New York Times, just kind of giving us a real good layout of what's happening when you put these vaccines into your system and what their true purpose is, right, Dean Flynn?
Thank you, Prescott. I did want to ask you about the journey. So we went from a virus that we may not have seen in humans, probably late last year, it started to kick in. When it became evident to the world, we immediately started thinking about a vaccine, since that's how we've prevented other diseases and pandemics and epidemics.
Right.
And we went from the initial conjecture to then understanding the science of the vaccine of the virus and then producing vaccines. The journey has been very fast, I believe. So I'm curious why you think we had that level of success into its speed. And then kind of as a correlate, with one of the issues being the safety of the vaccine, can you comment on why should we feel it's safe? How have we tested it to feel comfortable with that outcome?
Right. So I think there's a series of not serendipitous activities that have occurred, one of which is that the research communities across the world began to partner and collaborate in ways that we just haven't seen before. Sharing information from the Chinese, the early RNA sequences of the viruses, and the ability of labs that literally stopped doing the research that they had been doing, but focusing on trying to figure out how do we defeat this COVID-19 virus, because it was killing their inhabitants, like people in the United States and around the world. So just to start back a little bit, traditional vaccines like the flu are made by identifying those key viral proteins. The last chart we showed you, the little red areas are the uniqueness about the antibodies that your body makes to attach to the parts in the COVID virus, the spike protein. Unfortunately, the flu vaccine takes well over a year to produce, and that's because we've been doing it for like 30 years. And so the FDA and other regulatory groups around the world have a pretty good idea of the safety of the vaccine and the way that it's made. And so there really aren't too many, despite the anti-vaxxers, really aren't too many serious effects to getting the flu vaccine. But pharmaceutical companies, they go through the process of identifying which particular proteins are going to be the ones that are protective. And then they have to literally put them into eggs, generate viral particles, purify them, and then testing to see if that particular vaccine protects people. They go through phase 1 and phase 2 and phase 3 clinical trials. And only then do they actually start making the vaccine in large productions and getting ready to distribute it around the world. Operation Warp Speed that the administration has put together has changed the landscape. I mean, just absolutely has changed the landscape. And I think it relates back to what you were saying, Stuart, of how did they get it done so fast? Well, a couple of things. There's a government agency called DARPA, the Defense Advanced Research Project Agency, that has been doing groundbreaking research, built the internet and a few other 100 things. And back in 2004, actually Admiral Brett Gerard, who's now the Deputy Secretary of HHS, he really is a vaccine guru because he did a lot of the work with both Pfizer and Moderna companies to understand how can we use the human body to generate those proteins rather than growing them up in a bunch in the millions of eggs. And then you don't have to purify it, it's in your body already, and your body can then do the reaction. So that's really it's like a 10 to 15 year journey that we're leveraging for these messenger RNA vaccines. They're not really vaccines. They're the messages that go into your body that let your body, your muscle cells, make the proteins that the body will then react against. And that makes it a much, much faster process.
Can you comment real fast on the issue, obviously, which is being raised, and it's politicized and it's also science. How would you share with our audience that if a vaccine gets FDA approval, you believe it's as safe as it can be, recognizing there are side effects to everything we do in medicine?
So can you bring up chart 3, and I think we can talk to that, and then we can get into the clinical trials discussion. So this is a picture, and I believe this is from Science Digest. It is a pictorial view of how this messenger RNA works. Part of the challenge is that messenger RNA cocktails that stimulate your muscle cells to produce the spike protein of the COVID virus, not the virus, not the complete virus. So there's no virus there to make you infected. It's the proteins that the virus uses to connect to your cells and then enter the cells and infect it. So by making that purple area, that colored we showed before, that now allows your body to be tuned to use its mechanisms, not somebody else's mechanisms, but your mechanisms to actually fight that particular problem. Now, in terms of the clinical trials, that's another area where they have made some tremendous progress. In many of the cases, Pfizer and Moderna in particular have been able to combine a phase 1 trial, which is the safety part. Can human beings receive this kind of cocktail, the messenger RNA with the lipoprotein wrapped around it in nanoparticles? Can you take that? And will it make you really sick? Because of the speed and the warp speed project, they were able to combine phase 1 and phase 2 trials. Phase 2 trials are really about, is this process going to result in a response from your body that will actually protect you from the virus? And in fact, those phase 1 and phase 2 trials were done both by Pfizer and Moderna, and they began earlier this summer the very large scale trials that would allow them to be able to get the vaccines and prove that they're safe and prove that they're efficacious. So they've accomplished that.
And Dr. Silva, we did have a question come in from Facebook while you were speaking about this particular process. I just want to, before I get to that question, I just want to let everybody know today, this is FWMD Live, and we're having a conversation about COVID-19 and vaccines. We have University of Texas at Arlington research professor, Dr. Silva, joining us for this discussion, and also the illustrious and fantastic founding dean of the TCU and UNTHSC School of Medicine, Dean Stuart Flynn. So if you have any questions about COVID-19 and vaccines, get into the comments, leave your question, and then I will definitely make sure we get both of our fine physicians here to give you some answers. So Dr. Silva, the question from Facebook is the virus evolving at all? And also, if so, will the vaccine that's being produced right now remain effective?
Oh, that is a great question, because the little buggers do mutate very, very quickly. Fortunately, not quite as fast as the flu vaccines, the adenoviruses. But yes, they have right now, I think they've had like 28 or 29 different mutations, but the COVID virus requires that spike protein to attach to the cells that have the ACE2 receptors. And if they can't do that, they don't infect. So that's what's called a conserved region in their genome, their RNA genome, that they don't fiddle with, because if that breaks, then they don't work. Then that's like, the population death. So fortunately, so far, and again, it's early into this experience, so far there's not been a single mutation that would obviate the vaccines that are being developed today.
And Dr. Silva, when I think about vaccines, right, and this vaccine getting approval, we get flu vaccines every year. Everyone is urged to get a flu shot every season. But when you think about the approval process, when Moderna and Pfizer are saying it could be approved within days, what exactly is actually happening right now in that process?
So I kind of skipped the question that Stuart asked about the clinical trials, but we'll come back to that. But let me really target this. It turns out that when there is a national declared public health emergency by HHS, that the Federal Drug Administration, FDA, has a process by which they can accelerate certain kinds of activities. Testing is number one. They've approved a slew of tests for the coronavirus, the RNA in it, which is more indicative that you actually have a disease, and the antibodies that we make, or the proteins that the virus shed, that don't necessarily mean that there's an ongoing infection. And they've approved a whole bunch of these. The other thing that happens is there is an emergency use authorization for various different countermeasures, small molecule drugs that can maybe target the virus itself, or like the vaccines that we're seeing now from Moderna and from Pfizer. It turns out that on the 10th, that Pfizer has already submitted a request for a review under the emergency use authorization with the FDA. And on the 10th of December, I believe that's still true. This is a very long name, and the acronym is much worse, but it's the Vaccine and Related Biologics Products Advisory Committee, which is if you want to get a who's who in vaccine research around the world, the experts, it's them. And they sit independent of the FDA, and politicizing this isn't part of this at all. They make the analysis looking at the drug makers' documentation for the phase 3 trials, which are the extended safety and efficacy trials, that the data is suitable, that it is accurate, and it hasn't been fudged at all. And that the protocols for the trials, which are extremely rigid, both for phase 1, phase 2, and phase 3, have been adhered to. So if all of those things are met, then they review the efficacy data, and they also review any of the data on side effects. And it looks like now both the Moderna and the Pfizer, from everything I've seen in the literature, but not the actual, the results of the trials, about 5 to 10% of people will have a level 3 adverse event. That means that for a day or two, you can't do what you normally do. It's like getting a really bad flu. You get sick, muscle aches, and all the rest of that stuff. And then, by the day 2 or 3, you're able to at least sit up in bed, right?
Right.
4 are major effects, serious side effects. And from what I understand, neither the Moderna or the Pfizer vaccine has had any serious side effects, level 4 or level 5. Level 4 is somebody that has to be admitted to the hospital. Level 5 is somebody that died of having received the vaccine. And you may have seen in the news that there are a couple of vaccine trials had to stop while they investigated. And it turns out that they did a very careful, thorough analysis, and it was not related to the vaccine. It was related to other conditions that particular individual had that resulted in being hospitalized or dying. So we're actually really in good shape here. Moderna's FDA review is going to occur on the 17th, and literally, if the 10th, the FDA committee says yes, fine, and the FDA says yes, we accept your recommendations, that committee can't make a yes, you can do it. That's the FDA's authority and responsibility. They review the recommendation and then they say, yeah, go ahead. Pfizer's already queued up, I don't know, 20, 30 million doses of this stuff to ready to be distributed on the 11th of December. And we'll get into some of the downstream issues once the vaccines are in a plane or out in a truck going to the various states and places where they're going to be distributed.
Well, you anticipated part of my next question. We were joking before we went live that information we share at the beginning of this session may be outdated by the time we're at the end of this session.
Right.
And I do know there's just rapidly breaking news today. And I think you already hit on a little bit, and it is 20 million vials for the end of the year. Can you share what we know? Because there does seem to be an element of consistency to this, especially for those of us who just love get stuck with a needle with a vaccine. What's the
Hmm.
dosing schedule look like? And
Okay.
what's the, if more than one, what's the time lapse between the
Sure.
first?
So both of these particular, I hesitate to call them vaccines because they're really protein manufacturing factories that use your body. But both of these agents, shall we say, um, are injected intramuscularly, typically in your arm. The Pfizer vaccine requires 2 doses, 21 days apart. And the Moderna vaccine also has 2 doses. There is 28 days apart. And the first dose, think of it as priming the pump, getting your immune system and machinery ready to go fight. And the next dose, generating more of the protein, now kicks it into high gear and generates some immune effect that we don't really know how long it's going to last. So that's one of the other things that happens now with the vaccine being distributed to Americans is what happens over time. How long does that thing last? Do you need a booster in the summer? We don't know those questions yet.
And I just want to jump in real quick. Dean Flynn, I am not one who likes getting stuck with needles. So I mean, I would like a vaccine, but the needle part, whether I'm getting a flu shot or any other thing, yeah,
Prescott,
I never really look forward to that.
let me give you the choice you got. Okay. You either get a shot in your arm or you have a bunch of IVs in a tube in your throat in the intensive care unit. Maybe not for younger people, but for us older people, we really worry a lot about that. And yeah, I mean, there's a lot of misinformation. We'll get into that a little bit later about vaccinations. But for us, given the lethality and the rapid spread of the COVID virus, it's really not a question.
Right.
You know?
Yes, and of course, like I'm willing to take, put my fears to the side, and I think we all should for the greater purpose.
Yep.
Of
Exactly.
protecting humanity and protecting our health, right? So yes, I will definitely stand in line and come on, doc, you can give me the shot. It's all good. I won't cry. But I do want to say that we got some questions. We got some pretty good questions for you on Facebook while you were talking, Dr. Silva. Everyone watching, this is FWMD Live. Today we are talking about COVID-19 and potential vaccines. We have University of Texas at Arlington Professor Dr. Silva with us, and also our founding dean at the School of Medicine, Dean Stuart Flynn. They can answer any questions you have about COVID-19 and vaccines. Jump in the comments, leave your question, and then I will get you some answers. And so let's go back to our first question. And I know this is probably a big one, Dr. Silva, and maybe you can kind of simplify it for us. But our viewer wants to know, what are the differences between Pfizer, AstraZeneca, and Moderna's vaccines?
Okay, that's actually a relatively easy question. It turns out that Moderna and Pfizer are using the messenger or mRNA approach, the one that they actually, DARPA paid them 20 years ago to actually start working on using this to use your body as the engine to generate all the proteins, so you don't go through the 1,000 million eggs and have to purify it and all the rest of that stuff. AstraZeneca, from what I understand, is a more traditional vaccine. I've looked at some of the literature and looked at some of the press releases, and I think they're going to have a significant challenge with their situation. I can't say really too much more than that because I don't know the actual data, but their trials appear to have had some rather important changes occur in them over time. And then it makes analyzing the data really, really tough.
And Dr. Silva, we also got a question from Matt Howerton at WFAA. Thank you, Matt, for jumping in and listening and leaving your question. So he wants to know, simply put, and you kind of addressed this a few minutes ago, but simply put, what would you tell someone skeptical of taking this vaccine? And also, what is the danger of not taking this vaccine and not creating viable herd immunity?
Well, I think I answered it talking to you, Prescott. I mean, the real, now, if you're 20 years old you're probably not going to end up in an ICU. Probably, I say, but there have been children and teenagers dying of this thing. And I don't know that there's any study yet that says these are the 5 things that if you have as a 20-year-old, look out. That doesn't exist yet. So you're taking a chance. But even worse, and it's sort of the face mask problem, and I don't want to politicize that, but our duty as citizens is not to harm anybody else, right? And if we do, we get arrested. If you have COVID, you don't know about it, and you're with a bunch of your buddies drinking beer or whatever it is, or at the beach, et cetera, maybe that's a little safer, but certainly indoors, sporting events, you spread that virus around. And the 6-foot rule, I've been looking at some of the research literature, and the actual plume that you use when you shout or when you sing, things like that, cheer somebody on, actually can go for 20 or 30 feet. And the particles that are distributed literally go everywhere. And so if you happen to be a younger person that is very healthy, you don't know that you have COVID because you're not sick, or you maybe had a little bit of the flu, but it was COVID, you can spread it to literally hundreds of different people, and then they'd go viral. I mean, this is the whole notion of going viral is literally being able to have this exponential growth, because 4 becomes 12, becomes 25, becomes 100, and it just keeps on growing until you stop it with people that, okay, I can breathe in your COVID stuff, dude, but I'm not going to get sick because I'm immunized, I'm protected, I'm prepared.
Right. And you know, as we talk about this vaccine, Dr. Silva, so the good news is that there is a vaccine that is very close to being made available for the general public, right? So I want to play a little bit of devil's advocate here. And even though once this vaccine is available to the general public, what is the bad news? Is there any downstream side effects or things we should be aware of that could happen once the vaccines are available and everyone begins to take it?
So you hit upon it a little earlier, Prescott, which is the misinformation, or the people that, I don't really want to get a needle in my arm, dude, you know, kind of stuff. That misinformation has really made it very difficult. Now, interestingly, I've watched some of the national surveys that have done about misinformation and about acceptance of vaccines. As that peak keeps climbing higher and higher and higher, and more people die, the rate of people that not want to take it's gone down, down, down. So I think people are finally getting weary of the damn COVID, but also understanding more that I'm at risk. And if I don't do something, if don't get prepared, either by wearing a mask, getting a shot, or all the above, then, you know, I have a good chance of hurting other people. And certainly in multi-generation homes, that's got to be a really major problem, particularly the older family members that are very, very susceptible. I resemble that remark. I won't say for Dr. Flynn, but I have enough grandkids that they don't come to the house anymore. So at any rate.
Can you share, you know, something we're watching break right now, today, what the hierarchy of who will get the vaccine first, which obviously is very tough vis-a-vis first responders, teachers, essential workers, assisted living facilities. And then I will say parenthetically, the medical students have asked, do they fall into one of those high categories? And they're asking it very seriously because they're out taking care of patients. My response to them has been, they will get it after their dean gets it. I don't think they're finding that very comical either. So I'm kind of curious, what are your thoughts of how this decision is being vetted? Because we can't have it for everybody on the first day.
So the Institute of Medicine, which is sort of the grand gentlemen and dames of the medical community, have put together looking specifically at this question: What's the strategy to provide an equitable but risk-based approach at immunizing Americans against the COVID virus? CDC has a panel for advanced committee on immunization practices that, much like the FDA's advisory committee, thinks through these issues with them and then provides CDC with some recommendations. And they just released their first recommendation. I think it was late yesterday or maybe early this morning. There are sort of top priority categories 1, A, B, and C. A are the health workers and residents in long-term care facilities, which is clearly the way to go. I mean, the people on the front line, CDC's, excuse me for looking down here, but CDC's reporting on health workers that have been infected. And right now we're at about 245,000 health workers that have been seriously ill with COVID, not just COVID, but just have been hospitalized. And out of that, there's been somewhere around 900 deaths in people that are been in the front line taking care of workers. So I don't think there's really too many questions in the United States about making sure that the people that are taking care of me if I get sick are immunized so that they don't get sick from me. And so I think that's pretty much that. And the other is the nursing homes, the assisted living, they have account for 40% of all of the deaths in the United States. And so protecting them, because they are so vulnerable, and protecting the workers that work with them so they don't bring anything into the nursing home, I think makes a logical part A of health workers, long-term residents, and then the workers that are associated with those. They are in the process of working down the next levels, A, 1B and 1C. A number of different ideas come up. People who are in essential jobs, firemen, EMTs, and things like that, particularly those that would come in contact, and police that would come in contact with, they're the frontline workers, and they probably would be the next batch. But I don't think that there's been an official decision, certainly not from CDC, about what's that. Let's get the first batch out. Given that they're health workers, it turns out that it's that they're the canaries. Sorry, Stuart, but I mean, if you have a reaction, an adverse reaction of type 3 or type 4, you're going to be in the place where somebody can take care of you and identify that this thing is really a problem, or no, it's something because of the diseases that you have that are flaring up that is causing this problem, and not from the virus itself. So that's kind of, in essence, a safety net for the rest of us, because the most better surveilled individuals happen to be health professionals, right? And so they're going to be getting the vaccine first. And if there are any issues, we should be able to find out about it. And now the 40 million doses that looks like Moderna and Pfizer will be providing before the end of the year represent 20 million immunization activities. Because remember, it takes 2 vaccine sittings, 2 needle sticks, Prescott, for you to be fully vaccinated. Sorry, I don't mean to pick on you, but
no, it's fine.
It's a good example. So there's really 20 million people that are going to get vaccinated. One of the things within the health community is that there are people that are on the front line, people in the ICUs, people in the emergency departments who actually come in contact, more close contact with those that are actually infected with COVID-19. The people that are in private practice, I go to Hopkins. Everybody that is seen in a Hopkins outpatient clinic or office has to have an RNA a sample taken, a swab, and make sure that you're not infected. So those people are probably okay. They're not dealing with it. But the people that are in the hospitals, particularly the people in the upper northern tier states that are getting totally crunched, they're having to have ICUs in places that there isn't an ICU, but they have to make it one. I would think that those people should be immunized, first along with that, and then see how things are going after that. Does that
And
answer your question?
Dr. Silva, I actually want to jump in because while you're giving that information, we got some pretty good questions to follow up on what you just spoke about from
Sure.
Facebook. So the first question is from Jennifer Hume. She said, will there be a version of the COVID-19 vaccine specifically for those 65 and older, like the current flu vaccine comes?
I don't know the answer to that question. I have not seen any dosing schedules for people. I get the 4X vaccine and regret it the next morning, but know that I'm being protected. So yeah, I don't know the answer to that question.
Okay, and we had another question from Kelly. So Jennifer, thank you for your question. And also Kelly, thank you for your question. This question is about availability. And this is maybe a rare situation, but maybe you can explain to us what would happen in other situations. So Kelly's question is, should we be worried about availability? What happens if we get the first dose and there is a rush for the vaccine and we don't get the second dose?
So that's a great question, and that's something that the local public health departments and hospitals that are distributing the drug have to figure out. My sense is that you're not going to be completely protected against COVID until you have the second vaccine shot, and those,
Right.
I would imagine, would get prioritized ahead of people that haven't had their shots yet.
Right. And that makes a lot of sense that they would place priority on,
Right.
on those people. I just want to let everyone know, if you're just joining us today, this is FWMD Live, and we're having a conversation about COVID-19 and vaccines. If you have any questions, we have University of Texas at Arlington Professor Dr. John Silva with us. And we also have the Dean of the TCU and UNTHSC School of Medicine, Dean Stuart Flynn, with us as well. So if you have questions about vaccines, COVID-19, jump in the comments, leave your question, and then we will definitely get you some answers. Dean Flynn, I know you also wanted to take this conversation to a space where we can talk about social determinants of health, right?
Right.
Right, exactly. So John, you know the landscape of Tarrant County and Fort Worth and Arlington at a very nice level now. You having been working here for a while. Can you just give us an overview? I know this has been addressed at a national level. We certainly know the morbidity and the mortality in people of color is disproportionate for the number infected. Comments and observations that we can make, that you can make at this point in time?
Yes, well, it turns out that in Texas is a little bit different than the rest of the country, in that both colored populations, Black and Hispanic, are at a much higher risk of developing COVID, and that they're also a higher risk of dying from COVID. And that is something that the state of Texas and the individual public health departments are going to have to address when they look at how to formulate their vaccine distribution mechanism. So we at UTA have been working on trying to identify those areas within Tarrant County that have the highest possible, the highest number of at-risk individuals. And so if you could bring up chart 4, this is, I'll do a little bit of forewarning. This is from a health intelligence atlas that we are working on. And can you bring up chart 4?
Sure, we can bring up chart 4.
So what you're seeing here is a map at the census block level of Tarrant County. The darker shades of whatever that color looks like on your screen, to me, it's kind of like deep red or something. The darker areas are those areas where there is a higher degree of vulnerability. And CDC uses a 12-element scale to determine the vulnerability index. Transmission rates, the rate of infectious spread, the mobility and concentration of the population. So are they moving around a lot? Are they going to bars and restaurants and other things like that? The density of the population itself. There are using anonymized cell phone data. There's a way that you can see how well people are socially distancing. I'm sorry, that's a mistake. It's the cell phone that's doing the distancing. It happens to be carried by a person, so it's not identifiable. It's just that by looking at the anonymized data, you can tell where people are kind of getting together and staying together long. Anything more than about 15 to 20 minutes indoor mean that you really increase your risk of getting COVID. And if you're not wearing a mask, if there's a COVID spreader, super spreader with you're going to get sick. Intervention testing, how much testing is going on, the ethnography and the population demographics, air pollution, age distribution, because clearly we know that over 65 has a much higher rate of getting COVID and then actually getting seriously ill or dying from it. Health environment disparities and the availability of hospital beds. So it's a summary of all of those elements, and you can see the darker red areas in Tarrant County. There's plenty of them in Arlington and Forest Hills and Halton City, et cetera. And what we're trying to do is work with the Tarrant County Public Health to identify the highest risk areas within these colors. We have some tools that we're working on to identify, where have the hotspots come, where might they likely be, and then help that to provide the decision making for Tarrant County to distribute the doses that they'll have available. I think that's it for that slide.
Yeah, and that's actually really, really great information just to have that insight as to how things are around Tarrant County as far as people gathering in groups and the likelihood of being able to get or spread COVID-19. So that was very helpful. I appreciate you giving us that graphic and kind of giving us the details behind what the thought process might be once the vaccine is available in Tarrant County. So thank you for that. And on that note, that is going to do it for our live chat today. I want to thank everyone out there on Facebook for being a part of today's live chat. And I also want to give a huge special thanks to our guests, Dean Stuart Flynn and Dr. John Silva.
Well, thank you for having me with us. This has been very exciting, and getting questions from the participants on the live Facebook. It's just really amazing that we can, and as Stuart mentioned, it's literally on internet time. 20 minutes ago, the CDC may have put out some brand new thing. So stay tuned.
Great.
Thanks, Dr. Silva, and thank you, Prescott.
Yes, thank you so much, Dean Flynn, for taking the time. Thank you so much, Dr. Silva. I also want to let everyone know, if you left your question in the comments and we didn't get it answered, there's a lot of information in this live chat. So as soon as we're done, you can go back on our Facebook page and rewatch it from the beginning. And likely Dr. Silva, I'm almost positive Dr. Silva has answered your question if we didn't get to it late. So make sure as soon as we're done, go back and take another look, and I'm sure he can, he's answered some of the questions that you have put into the comments. Now, I want to remind everyone about the annual healthcare forum that's co-hosted by our medical school and the TCU Neely Business School, coming up on December 9th at 7:50 a.m. This year, the event, which is normally in person, but given the circumstances with COVID-19 and the current pandemic, the event is going to be virtual this year. So you can use the link in the comments that we have provided, and that link will take you directly to a place where you can get signed up for the event. And that event is going to be free and open to the public. And also it will be streamed on our Facebook page, so you can watch it there as well if you don't get an opportunity to sign up. But the link is in the comments, so make sure you click it, and that'll get you to the place where you can get signed up for the annual healthcare forum. Now, the forum itself will be hosted by our great Dean, Stuart Flynn, and also TCU Neely Business School Dean Daniel Pullen. They both will be moderating this discussion with artificial intelligence experts who will offer perspectives on the role that AI has played in the pandemic, and also the role AI is playing in the advancement of healthcare. So that should be a really, really good conversation. And again, that is coming up on December 9th at 7:50 a.m. Make sure you wake up early, get your coffee, and get in front of your laptop and click that link that you signed up for, and get ready for a great discussion about AI and its role in healthcare. Also, I want you to make sure you follow our Facebook page, because soon we will be putting up information about our next FWMD live chat that is going to take place on December 17th at 1 p.m. We will be showing the top moments from the show this year. And we will also have two of our medical students with us, a first-year medical student and a second-year medical student, for an Ask Me Anything session. Make sure all the medical students are watching. I know we have a lot of medical students who actually participate in our conversation. So if you have questions about medical school, what it's like to be a first-year medical student, what it's like to be a second year, what it's like to be at a brand new medical school, have those questions ready to go on December 17th at 1 p.m. and we will get you some answers. And also, while we're showing the top moments, you can always go on our Facebook page and go to the video section, and you can watch all of our FWMD live coverage that we've had throughout the year. We've had so many great discussions on COVID-19. We've tackled mental health, we've tackled racism, and many, many, many other topics as well. So December 17th, 1 p.m. Make sure you join us for that discussion. And also, if you missed the discussion on Facebook, if you're a YouTuber and you love watching videos on YouTube, well, guess what? You can go to YouTube, look for the TCU and UNTHSC School of Medicine, and then subscribe and like our YouTube page, and you can watch all of those videos as well as more content about our school. You can get an inside look at what the students are learning here at our new approach to medicine, how we're training empathetic scholars. So go to our YouTube page, sign up, subscribe, and you can get more great content just like this and much, much, much more. Once again, thank you all for watching today, and we will see you again on December 17th at 1 p.m. See you later.